Okay, as I explained you about the neuronal part of the skull and the different types of bone that will make the neuronal part, we also have the visceral part. That also different types of bones will make this visceral part. Let me show you the bones that will make the visceral part. The first one is the zygomatic bone that has a star shape. The second one is this green one, the maxillary bone, and the third one is the mandibular bone. You know that the upper teeth, which is attached to the upper jaw, we can call it maxillary teeth, which is not movable, and the lower teeth that is attached to the lower jaw or mandibular bone, we call it mandibular teeth, that is movable. Also in this part we have different types of foramen. For example, we have infraorbital foramen, which is located below the infraorbital margin. What is infraorbital margin? It's here. That two bones is made this margin, a part of zygomatic bone and a part of maxillary bone. And also we have supraorbital margin, that the frontal bone, the blue one, can make this margin. As I told you, below this infraorbital margin we have infraorbital foramen, that through this foramen we have one of the most important artery, vein and nerve which exit from this foramen and make three different branches for all maxillary teeth. That's why it's very important for us. Another foramen which is located in both sides of the mandible is mental foramen. This mental foramen is for mental nerve. The mental nerve will exit through this foramen. Uh, and it's for chin. It's for innervation of chin. It's very important. This mental foramen, we can say it's a continuation of another nerve. Which nerve? Inferior alveolar nerve. Alveolar means it's for teeth. For example, inferior means low. Superior means up. When we say inferior alveolar teeth, it means it's for lower teeth. Superior alveolar, it's for upper teeth. So we can say the mental nerve is a continuation of inferior alveolar nerve. Inferior alveolar nerve is for all inferior alveolar teeth. And I'm going to explain you all the nerves by detail. Don't worry. Another foramen which is located in frontal bone. It's not a part of visceral part of the skull. It's here. It can be foramen or it can be notch. If it's not a hole, it's like a fissure, we can say it's notch. It's not foramen. And also it's for one of the most important, again, artery, vein and nerve. You know that what is artery, what is vein, and also you know about nerve. Artery is for supplying different organs in our body. It can be in our head, neck, or other parts. And vein is the deoxygenated blood that will take blood from organs to finally drain it to the heart. Okay? It's about this bone. Also in the middle part of the uh, face, we have nasal cavity. Inside the nasal cavity, we have the bone. This is the nasal septum. the continuation of this septum, we have another bone, it's vomer, this pink one. Let me show you another picture for this vomer. It's here. It's here. This all pink one is vomer, and just the beginning part can be visible in the continuation of nasal septum, and it's important. Also in the nasal cavity we have other bone. We have concha. Concha is a part of ethmoid bone. What is ethmoid bone? The bones that I talked to you in the previous video or in the beginning part of this video are about the bones that will cover the skull, that we can see them. Okay, but we also have other bones inside the skull that uh, are not visible, but they are very important, but they are not visible. One of them is ethmoid bone, which is small, and a part of this ethmoid bone that we call it concha is visible in nasal cavity. Later I'm going to explain you about these bones that are inside the skull. Okay, and another part that is very important for dentistry student, it's about the infratemporal fossa. Infratemporal fossa is this part. It's very important, and for reaching to this part, we need to remove two parts: the zygomatic arc and the mandible. What is zygomatic arc? Two bones can make this zygomatic arc. The part of temporal bone and also the zygomatic bone, the beginning part of the zygomatic bone. We have to remove it, and also we have to remove the mandible. What is the name of this part of the mandible? It's the ramus of the mandible. This part is the body of the mandible, but we can't remove just the ramus of the mandible. If we want to remove a part of mandible, we have to remove the whole part of the mandible, not separately. But we call this part as a ramus of the mandible. Okay, then we reach to this part, infratemporal fossa. This part is very important because the most important artery, nerve, and a vein are located here. And then in this part, we have different types of branches, for example, for artery. That is very important in dentistry. That's why here is very important for us. Another part that I forget to explain in first video is about the sutures. Sutures is very we can say it's very good and it has advantage. For what? Let me explain. What is suture? Suture can be separate the different types of bone from each other. For example, the frontal bone, this blue one, can be separated from the parietal bone with the help of this suture. What's the name of this suture? Is coronal suture. This suture, okay? And also from two parts of the parietal bone, we have another suture, is sagittal suture. And from the parietal to the occipital, we have another suture, lambdoid suture. The advantage for this suture is, for example, if any infection happen here in frontal bone, in periostal layer. Os in Latin means bone. When we say preostal layer, it means one layer before the bone, because we have some layers that the most outer one is skin, and then we have also other layers in this part. But one layer before the bone is preostal, or we can say precranial layer. Okay, and then we have bone. If any infection happen in precranial layer or preostal layer, it cannot reach to, for example, in this part, in another bone, if any infection happen here in frontal bone. Also, if any infection happen in one of the part of the parietal bone, it can't spread to another part because of this suture. And also, if any infection happen in parietal part, it can't spread to the occipital bone because of this suture. And its advantage, it's good for us that the infection can't spread from one bone to another one.